Hi, my name is McKennon, and I am studying trauma nursing in ISM this year. My mission statement in ISM is to learn more about emergency medicine and to become familiar with a chaotic work environment in order to be able to provide effective care to those in need. Also, something that I'm focusing on throughout my study in becoming a trauma nurse and throughout ISM is a quote I read from Mother Teresa, which is, "Never be so busy as to not think of others." This is really important to me because in trauma nursing, it's all about putting your patient first. Even though you have awkward situations with the families or with the doctors, you have to know that what you're doing is specifically for the patient. Why am I becoming a trauma nurse? Well, because my dad passed away when I was 8, and they told me that if there was a doctor on scene or if the helicopter had gotten there 3 minutes earlier, he would be alive. And so I want to be there to make sure other people don't go through what I went through. Also, because I'm very, very passionate about trauma nursing. It is something that gets me so excited, and I get like goosebumps, and I just want to learn more and more about it every day. Also, I always want to help people. Some basic information I learned from my research assessments is like the skills that you need. Time management is very important, especially when it comes to triage. You need to know who's first, what you need to do first, and you need to get everything done in a time-effective manner. Also, you need to be very organized when it comes to scheduling and charting. You also need, like I said with triage, you have to make calm and correct decisions very quickly. More basic information, like with the certification and schooling, it's best if you have a bachelor's degree. You can also get an associate's degree, or you can go to any hospitals that have training programs for nurses. But also what I'm planning on doing is getting a master's degree, but I'll talk about that later in my presentation. All nurses get certified through National Council Licensure Examination, and for emergency health, you have to be certified in Emergency Health Administration. That's what like EMTs and the helicopter nurses do. One of the articles I read, this is one of my favorite ones that I read for my research assessments, is what nurses can expect in 2014. This is something that people have been telling me ever since I told them that I want to become nurses. There's always a need for more nurses, always, 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 and especially with the lack of doctors, more nurses are needed. So there's a higher demand in nurses. Also, many nurses are expected to have a higher education. Like with any other job, if you have a higher degree, you're the one that's going to get picked. A master's degree will get picked over the bachelor's degree. Also, and this is my favorite thing that I read. Stop recording. Okay. My favorite thing that I read was holding influential roles on hospital boards. The lady that wrote this article, she wants to encourage nurses that to be on hospital boards, because it's usually doctors and nurses don't get their say for anything when it comes to charities or, like I said, the hospital boards. But it also puts an emphasis on the goal of patient happiness. Risks, another really interesting thing, this is what I like about trauma nursing the most, is that it's dangerous, and especially when I want to go into the military, it's very dangerous. And like I've read stories of it being so overcrowded and the patients aren't getting enough attention, so they get very violent and take it out on the nurses because it's who's there, and I think that's very scary and interesting. There are also health risks, which is the less fun part, because if you get stuck with a needle, you could get AIDS, you could get other diseases that are very, very bad, and you'll have to deal with for the rest of your life. This is what I want to do also. After I become a nurse in the Army and I do my active duty and I retire, I want to become a nurse practitioner. Nurses assist doctors, record medical information, check vitals, prepare patients, while practitioners have their own practice. They can prescribe medicine, treat illnesses, and it's all required by a master's degree. I think that's very cool, because I could have my own practice and I could still be a nurse, and I don't have to go to be a doctor. Like, I don't have to go through school for that, other than a master's degree. But my first interview was my favorite. She was very, very nice. She is Nurse Nikki Wilk. She is here at the school at Lone Star. She has been a nurse for a very, very long time. She went through pre-op nursing, PACU nursing, critical care, endoscopy, and now she's a school nurse. The hardest part of her job was dealing with families. People, when People were very, very particular when it comes to their loved ones. They would come up to her and they yell at her when they're not getting the care that they think they need, even though doctors prescribe other care. She's the middleman between doctors and families. She takes all of the blame for everything, and doctors just stand back and let her deal with everything, or let nurses deal with everything. Like she said, like, what I like is also the high-intensity settings. She likes that as well. Nurse Melissa Whitehead, the rest of my interviews were actually over email, but this one wasn't. Melissa Whitehead, she knew she wanted to be a nurse when she became a mother. She's a NICU nurse right now, and when she gave birth to her daughter and she saw how they took care of her baby when it was premature, she loved that. She wanted to be exactly what they were doing. She wanted to help mothers just like herself. One of the hardest things about her job, and one of the most interesting, is that every baby has their own challenges. The first baby that she ever dealt with that was really, really bad was the size of a Coke can, and she helped it live. And the parents were crazy. The dad was sent out of the hospital, and he has a restraining order now because it was just such an awful situation for both parents, and she thought that was the most interesting. The hardest part is when it comes to hopeless cases in the NICU. I've interviewed a lot of NICU nurses, and they say the same thing. The hardest part is when you have to tell the parents there's nothing more you can do, and they just have to hold the baby. That's all you can do, is just be there for the baby. The advice from her is to study hard and chart well. Be organized and stay confident. Nurse Jin Chang was also one of my favorites. She's a NICU nurse. She says nursing is rewarding and convenient because you can schedule the hours around your life. There are always more nurses than there are doctors, so the nurses are always willing to take their shifts because, like she says later, you won't be a millionaire, but so every nurse is always like looking for shifts and such. So the hours are really convenient, and it's a very rewarding job. Nurse Melissa Stout is a surgical nurse. She was a surgical nurse, an orthopedics nurse, a bariatric nurse, a post-op, home health, a hospice, and now she's an insurance nurse. She said each patient brings with it a different challenge, and it's hardest when you can't please people because they're always. She said it's so hard when you can't please the people that they never get what they want. They don't have the care they want. They don't have the cost that they want. A lot of it's more expensive, and they complain to the nurses about it. It's very important she thinks it's very important for nurses to be active in organizations. Like the article I read about being on boards, and I think that's so important because nurses need to give their say. It's not all about what the doctors think. Nurses are there with the patients 24/7, and doctors are there for the checkups, the visits, and for the actual part. But nurses are there the whole time throughout their whole stay. She also says her advice for me was to intern or work in a hospital during college or high school if I can to get experience, because hospitals, especially hospitals, take people who have experience in a high degree. And so throughout all of college, she said to find a place where you can even be a secretary or just volunteer as a candy striper in a hospital. And thank you for listening to my presentation.